Hope I am audible. So good evening, and first of all I am thanking for your great patience. Little bit apologizing for the delay, but no compromise in quality, quantity and energy. Always don't give an example, be an example. I don't want to say you be energetic like that. Be an example always. Okay, so we'll go to the session. Must know in microbiology. Audio, video, everything is okay? Has everyone joined? Audio, video okay? Yeah. So relax. Only keywords. The pattern will be essay based question, case scenario. It may be half page. In the half page, you need to find the keyword. If you know how to find the keyword and you find the correct keyword, your answer will be correct. That is an art. Read fast, understand fast, analyze fast and catch it. So my class will be 30 minutes to 35 minutes. Okay? Good. Okay, thank you. So I'll start with trio. Disease, agent and vector. 100% we are getting a question on it. You should know. And it's a little dry area. Chagas disease. It's a collage, micro collage, cover to cover coverage. Chagas disease. What is the agent? Trypanosoma cruzi. What is the vector? The name of the vector is redweed bug. It's otherwise called cone nose bug, otherwise called assassin bug or triatome infestans. They have many names, but very common name redweed bug. Next is epidemic typhus. Suddenly came to bacteria. It is caused by Rickettsia prowazekii. What is the vector? The vector is louse. Sauda, or different clinical condition. Yeah, it's a cutaneous manifestation of Onchocerca volvulus. What is the vector? The vector is called black fly or Similian fly. Kala-Azar, everybody knows. It is caused by Leishmania donovani. And the vector is Phlebotomus argentypes in India. The common name, sand fly. Plague. Agent is Yersinia pestis. Vector, Xenopsella chiopsis. For North India, South India, Xenopsella astia. It's commonly we call it as rat flea. Got it? Simple. Malaria, everybody knows. Agent is Plasmodium species, Falciparum bivalves, whatever it may be. Vector, female Anopheles mosquito. If I may hide some of the things, maybe, I hope so, but don't worry, the PDF will be available. Next is continuous. Scrub typhus. Agent is Orientia susugamushi. Vector is mite. Trombiculate mite. African sleeping sickness. Suddenly we go to parasitology. So we need to read like this. Because in exam, the micro may not be continuous 15 questions, or they not give the title, this question is from micro. Sometimes micro will be under the shade of medicine. The whole history they gave medicine, and finally the question is basically from the microbiology question. What is the organism? What is the toxin? Like that. So we need to integrate. African sleeping sickness. Trypanosoma brucei, Gambiense and Rhodesiense. Vector is CC fly. Calabar swelling. It's a very famous condition, which is caused by, yeah, many people beautifully answering, great. Calabar swelling. Yes, lower. What is the vector? Deer fly, mango fly or Chrysops fly. It is otherwise called mango fly or deer fly. Endemic typhus. It's caused by Rickettsia typhi. The vector is rat flea. So rat flea is the vector for Yersinia pestis and endemic typhus. Epidemic typhus vector is louse. Please remember. Lyme's disease. Borrelia burgdorferi. We are aware of that. What is the vector? Hot tick. Dengue. Yellow fever. Chikungunya. Agent. Dengue virus. Yellow fever by yellow fever virus. This all comes under flaviviridae. Vector is Aedes aegypticus. Aedes mosquito. This is called day-biting mosquito or tiger mosquito. So these points will help you to clinch the diagnosis. I make you one paragraph question to ask only one Lyme disease. He is having a target rash, erythema migrans like feature. He used to go play in the woods, like all history. Finally, you conclude it's a Lyme disease. What the question may be? What is the vector? What is the causative agent? What is the treatment? They will ask only that. For that, you need to clinch the diagnosis. Okay? Right. Next is another trio, bacteria, selective medium colony. Very, very important. Different bacteria has different selective mediums and different colony morphology. You mix all together. Bordetella pertussis. Agent causing pertussis, whooping cough. Selective medium. Many mediums are there. Bordate jungu medium. Regan loevi medium, lazy DF, many are there, but commonly used medium, Regan loevi medium. What is the colony morphology? White color colony, mercury drop, bisected pearl, or aluminium paint. All are correct. Legionella, one among the agent causing atypical pneumonia. Selective medium, buffered charcoal yeast extract agar. Buffered charcoal yeast extract agar. Colony morphology, cut glass appearance. Cut glass appearance. It's a type of rapid revision. You must know. Legionella means you should know the name of the medium, name of the colony morphology. Pseudomonas. Selective medium, cetrimide agar. It produces different pigments. Under fluorescent light, it produces iridescent colonies. Iridescent colonies. Actinomyces. It usually grow in anaerobic organism, grow in blood agar, anaerobic condition. Blood agar is not a selective medium. Don't fight. Sir, blood agar is, I used to teach blood agar is enriched medium. But it's here anaerobic condition is a selective situation. Colony, it produces molar tooth colony. Molar tooth, spidery molar tooth or molar tooth colonies. Streptococcus pneumoniae. It usually grow in blood agar and chocolate agar. It produces typical ring colonies. What is it called? Karamcoin or Draughtsman colonies. Karamcoin or Draughtsman colonies. People beautifully answering. I'm very happy. Great. Haemophilus influenza. Oh my God. Suddenly little tough question. Yes, they have two beautiful mediums are there. One is Fildes agar. Another one is Leventhal medium. Fildes is the best medium. It also produces iridescent colonies. So iridescent colonies you can get in Pseudomonas and Haemophilus influenzae. So the take home message, you should know about the bacteria, selective medium and colony. Continuing. Staph aureus, the first bacteria what we used to read. What is selective medium? It is Ludlam's medium, which containing salt. Colony, gold and yellow color, oil paint appearance. Oil paint appearance, golden yellow. Next is Vibrio cholera. I plan to write actually. By lack of time, so we need to maintain. I want to give almost 200 points to you. Vibrio cholera. What is selective medium? There are many mediums are there again. TCBS, commonly used medium. Bile salt agar. And one is there GTTTA medium. MGTTTA medium, Monzoose, gelatin, targolite, tellurite, trypticase medium. But TCB is commonly used medium, high pH, 8.4 pH. It produces oil drop colonies or water drop colonies. Don't get confused. Oil paint and oil drop. Oil paint is in Staph aureus, oil drop is Vibrio cholera. Because they make you the story. It produces oil drop colonies in the selective medium, a diarrhea outbreak. darting motility, they give the history, that's all. Corynebacterium diphtheria mitis. All Corynebacterium diphtheriae, the medium is tellurite agar. The modification of the tellurite agar we call Tinsdale medium or McLeod agar. Tinsdale or McLeod agar, and mitis produces poached egg colonies. Poached egg colonies. Mycoplasma. The selective medium PPLO agar or Eaton agar. Colony morphology, fried egg colonies. Corynebacterium diphtheria intermedius. Any Corynebacterium you can go for Tinsdale or McLeod medium. Frog egg colonies. No confusion. Frog egg, fried egg, poached egg. Words are important. They give the just a description. Next is, hope you understand this. Next is, it is immunodiffusion. They may give the image based question or they may describe one dimension single diffusion. What is the name of the procedure? See in the test tube. Usually this happens in test tube. One dimension single diffusion, antigen alone moves. We call it as Ordin procedure. One dimension double diffusion, antigen antibody both will move, both will diffuse in the test tube. That is Auclay-Fulthorpe procedure. Next is two dimension single diffusion in the plate is radial immunodiffusion, otherwise called Manzini procedure. Next is two dimension double diffusion. In the plate both antigen antibody diffuses. We call it as Achorloni's procedure. So please remember, this is important. Immunodiffusion types: Ordin, Auclay-Fulthorpe, Manzini and Achorloni. Next is bacteria with microscopic appearance. They will give. These are all the clues. In the history, only one line the clue will come. If you know the clue, you can catch then and there itself. Otherwise, you need to see some other points. For example, Bacillus anthracis. It produces bamboo stick appearance colonies. Bamboo stick appearance in the microscopy. Streptococcus pneumoniae. Oh, it's like flame shape. Diplococci. We call it as lanceolate shape. Lanceolate shape. Staph aureus. Bunch of grapes. Staph means bunch of grapes, bunch of berry. Yersinia pestis, if you see on the microscope, safety pin appearance, typical safety pin. Not only Yersinia pestis, many other people are there. Vibrio parahemolyticus, Haemophilus ducreyi, Burkholderia pseudomallei. All the people are safety pin appearance. All Yersinia pestis, Yersinia enterocolytica, all people are safety pin appearance. Haemophilus ducreyi. The arrangement, it is safety pin appearance. If you see the arrangement, school of fish. Vibrio cholera, comma-shaped bacteria, but the arrangement, fish in stream. Do not get confused the words. School of fish, like school children, one by one they will go. Fish in stream. If you put some fish in the pond, they will go here and there. So, school of fish and fish in stream. Okay, 1 minute. Total 45 slides. You count. Now we are in 6th slide. Don't worry. So before tomorrow we'll finish. That means another 30 minutes. Maximum 30 minutes I'll finish. Back to microscopy. Corynebacterium diphtheria, how they look like in the microscopy. What is the arrangement? How the undivided gram-positive bacteria look like? Cuneiform, palisade or Chinese letter pattern. Chinese letter pattern arrangement. Clostridium tetani. A bacteria with the terminal spores, oval spores, look like drumstick. Terminal spores, round, look like drumstick appearance. Neisseria gonorrhoeae, how they look like? It's a diplococci, two people. It's look like kidney shape. Look like kidney shape. Campylobacter jejuni, how they look like? It's a cowed bacteria, look like gull-wing appearance. Gull-wing appearance. Bordetella pertussis. If you see the microscopy, it has typical thumbprint appearance. Every word is important. Neisseria meningitidis, both diplococci, both sides are flat, look like lens shape. So if they gave the description, they found kidney shaped bacteria in the urethral smear. You close the file, it's gonococci. Gull-wing shaped bacteria in case of stool, food poisoning. Then you decide it is Campylobacter jejuni. These are all the small words, valuable clues for you. Valuable clues for you. Okay. Next is defect and disease. Gene defect. List gene, we call it as lysosomal trafficking regulatory gene. Lysosomal trafficking regulatory gene. Defect leads to Chidiac-Higashi syndrome. Remember PPPP. What is PPPP? 5 P's. One is partial albinism, pyogenic infections, photophobia, peripheral neuropathy, nystagmus, pancytopenia. Pancytopenia. That is Chidiac-Higashi syndrome. It's a phagocytic defect. Next, if NADPH oxidase deficiency leads to chronic granulomatous disease, we shortly call CGD. So the catalase positive organisms will survive. Others will be killed. Catalase positive organisms usually survive. Example, Staphylococcus aureus, those people. NADPH oxidase. Great. BTK, Bruton tyrosine kinase. The gene helps to convert pre-B cell to B cell. So if there is no conversion of B cell, there is no immunoglobulins. So it is called Bruton's X-linked A-gamma globulinemia. Bruton's X-linked A-gamma globulinemia. Yes, nitroblate tetrasolim test is negative. Yes, great. ATM gene. Ataxia telangiectasia, both B cell and T cell defect. Ataxia telangiectasis. ATM gene. 22q11 deletion. That syndrome is also called catch-22. T cell defect. Dye-George syndrome. Abnormal faces, cardiac, thymic hypoplasia, cleft palate, hypoparathyroidism, hypocalcemia. So this is called catch-22 syndrome. Dye-George syndrome, T cell defect. CD55 deficiency. What is CD55? This is called DAF, decay accelerating factor, to prevent us from our own complements. Otherwise our complement will make a pore on your own cells. If the defect, what will happen? We are getting paroxysmal nocturnal hemoglobinuria. That's called DAF. CD55 nothing but DAF, decay accelerating factor. Defect leads to paroxysmal nocturnal hemoglobinuria. Great. Next is toxin and action. This is very important. You should know all toxins, but I made very important because it's a must know. In regular class, I used to teach all the toxins. Here, must know. Okay, without knowing this, don't go exam. That means must know. Or otherwise, you take this and little bit elaborate. I give the base, put some toppings. I am giving 5 toxins. You read 2 to 3 extra toxins, like that. Tetanospasmin. Mechanism of action, inhibit the release of GABA and glycine in the neuromuscular junction. Inhibit the release of GABA and glycine. These called neuroinhibitors. Inhibitory neurotransmitters. Botulinum, same type of action but inhibits acetylcholine, which leads to descending paralysis. 5 Ds, remember. Descending paralysis, diplopia, double vision, dysphagia, dysarthria, and deep tendon reflexes are reduced. DDD, DD, 5 Ds. It's all in the notes. It's all in the notes. Okay. Yes, because of that I put all logos inside the material. You see lot of dams logos are there inside. That means when we are ready to give only we put all those things. Okay. To avoid misuse, that's all. Overuse is acceptable. Misuse is not acceptable, my dears. Diphtheria. So mechanism of action of the toxin, both diphtheria and pseudomonas toxins have same type of action, acting on elongation factor 2, inhibit protein synthesis. Diphtheria and pseudomonas inhibits protein synthesis but acting on elongation factor 2. E. coli, stable toxin acting on cyclic GMP. Labile toxin, cyclic AMP. Cyclic AMP, many other people also, cholera toxin, anthrax toxin, even pertussis toxin, all the people are acting on cyclic AMP. Cholera, pertussis and anthrax, along with E. coli labile toxin, cyclic AMP. Shiga toxin as well as enterohemorrhagic E. coli toxin. It's called Shiga-like toxin. They also inhibit protein synthesis, acting on 60S ribosome, exactly if you want to say 28S ribosomal units. 28S or 60S ribosome is the whole. They inhibit the protein synthesis of the host cell. Got it? Great. Next is inclusion bodies and viruses. This is another important question. Either they'll give the image of the inclusion body or directly they name the inclusion body or they'll describe the inclusion body for the clue. Henderson-Peterson bodies. We shortly call HP bodies. Seen in molluscum contagiosum. Intracytoplasmic. One more HP also there. Helberstater-Provosac bodies. Seen in chlamydia. Okay. Helberstater-Provosac, that also HP bodies. Next is Negri bodies, very famous. Anybody can tell it is in rabies. Lipschultz bodies, usually herpes, HSV. Lipschultz bodies, HSV. Taurus bodies. Yes, in yellow fever. Taurus bodies in yellow fever. And yellow fever produces mid-zonal necrosis in the liver. It also produces Councilman bodies. Taurus bodies produced by the virus. Bollinger bodies, Foulpox. And Guarneri bodies, Vaccinia virus. Patient bodies, Variola virus. Remember Guarneri, Vaccinia virus. So please remember, these are all the important inclusion bodies. You need to segment and read. They may give the picture of Negri bodies or they mention in the histopathological examination shows Taurus bodies. Then think of yellow fever like that. Great. HLA with the diseases. Integrating something with medicine. HLA-A3. Remember HLA-ABC. ABD mainly. HLA-A3. Hemochromatosis. B08, Graves' disease. This already you know that, just you can recollect. B27, when you are there, remember the mnemonic pair, psoriatic arthritis, ankylosing spondylitis, inflammatory bowel disease, or irritable bowel syndrome, inflammatory bowel syndrome, and writer's disease. Remember pair, PAIR. DR1, it may cause myasthenia gravis. DR2, many things it may cause, but predominantly it causes multiple sclerosis. SLE also, but predominant, I am talking only predominant. DR3 associated with SLE. DR4, rheumatoid arthritis. DR5, pernicious anemia. Like Big list is there, but this is important. That means you please go and read. When you read the slide, you can add DR4, DR5, some other thing extra. There may be a question. It's not mandated. They need to ask question only what Dr. Surya put the slide. DR4 they may ask. DR5 give an idea. Oh, we need to go HLA associated diseases. Spend 5 minutes. When you read medicine surgery, when you feel tired, take this kind of small pot. Read only HLA. Mood will be changed. Then again read. For reading this, you can read surgery medicine. That thing will be very easy, like that you can go back. Cool. Markers and diagnosis. Hepatitis. Without this, no question paper you cannot find. I put little different way. Surface antigen positive, core antibody IgG positive. Then it is nothing but infection present and the disease also present, chronic hepatitis. Chronic hepatitis. I'm sorry, some mistake. Chronic hepatitis. Next is core antibody IgM positive. It's not bamboo stick, my dears. I'm sorry. I'll correct it. It is actually a chronic hepatitis. It is chronic hepatitis. Beautifully people answered. This is a mistake happened, copy pasting. Strongly apologizing. Don't worry, I'll correct it. Anti-HBC IgM, core antibody IgM, alone positive. What does it means? It means there is disappearance of surface antigen, and before appearance of the surface antibody, only the core antibody IgM present. That period is called window period. Next is core antibody IgG. That means surface antigen came, core antibody IgM came, that is acute hepatitis. Then surface antibody came, that antibody completely make the antigen disappear. Only the core antibody IgG alone present means it is a post infection. He is recovered, it's post infection. Acute means Sandeepan Bhattacharya and many people put acute. No, first one is acute. Right, great. Second window, very good. And only surface antibody. Now you answer. Many people answered. Nice. It is vaccination. Only surface, no antigen, no core antibody, not exposed to infection. Without infection, develop the immunity. That's called vaccination or immunization. Now, surface antibody present, core antibody IgG present. That means his surface antigen is disappeared because of surface antibody. Surface antibody not disappeared, it's present. Core antibody also present. That means his infection lost, but still the disease is present. That means that stage of the infection is called recovery period or convalescent. That's called convalescent. Where there is no surface antigen, there is no infection. Without infection, only core antibody alone, that's called post. Still surface antibody is present means he is recovering from the infection, that is called convalescent period. Okay, only surface antigen present. Many assumptions are there. Maybe very early stage of the disease, or he may be a carrier, simple carrier. Only surface antigen alone present, he is simple carrier. Along with others, envelope antigen, DNA, many things are present, super carrier. When you read of simple carrier, you should know who is super carrier. Super carrier means along with surface antigen, envelope antigen and DNA, many other things are having. Okay, good. Beautifully answering, I'm happy. Very simple, gene transfer process in bacteria and the name. I'll describe. Gene transferred via pilus. This is a bacteria, this is another bacteria. Along with a tube, conjugation tube, pilus, the plasmid is transferred. That is called conjugation. Plasmid is transferred, that is called conjugation. Direct uptake of DNA from the environment. The bacteria will take the DNA from the environment, directly take. That's called transformation. By Griffith, you know the experiment along with mice, Streptococcus pneumoniae. DNA transferred by a virus. The virus is called bacteriophage. Phage mediated is transduction. Two steps are there: lytic cycle, lysogenic. Lysogenic, many toxins are produced. Group A, Streptococcus toxin, botulinum toxin, cholera toxin, diphtheria toxin, E. coli label toxin, Salmonella, O antigen, many people. Remember A, B, C, D, E, S. A for group A Streptococcus, B for botulinum, C for cholera, D for diphtheria, E for E. coli toxin, and S for Salmonella typhi, O antigen. These are all transferred, these characters via transduction. So you should know the different gene transfer processes: conjugation, transformation, and transduction. And microbe associated with autoimmune disease. People's mind wise. Now the time is 11:40. He's in 14 slides only. How he is going to finish another 35 slides or another 30 slides? Yes, see. Gas means group A beta hemolytic Streptococcus. It associated with rheumatic fever. It's autoimmune disease. Campylobacter jejuni, ascending paralysis. What is it? GBS, Guillain-Barré syndrome. Guillain-Barré syndrome, jejuni serotype O19. O19 associated with GBS, Guillain-Barré syndrome. Chlamydia trachomatis associated with Reiter's syndrome. Can't see, can't pee, and can't bend the knee. Blindness, visual impairment, urethritis, and arthritis. Okay, that's called Reiter's syndrome, triad. Hepatitis B virus associated with multiple sclerosis. Cytomegalovirus with scleroderma. Please understand, cytomegalovirus associated with scleroderma. Coxsackie B3, most common cause of viral myocarditis. Coxsackie viruses are the most common agents causing viral myocarditis. So important: gas, jejuni, trachomatis, and Coxsackie B. Very important. Must know. Disease and hypersensitivity reaction time. Allergic rhinitis. We call it as atopy. It's seen in familial, runs in familial and seasonal. Type 1. Allergic rhinitis. We call it as atopy. Usually allergy is no caste, no caste, no creed. Anybody can get anywhere, anytime. Allergy. But they found it runs in families, runs in season. That's called atopy, type 1. Contact dermatitis. Poison ivy, poison oak, nickel, type 4, delayed type of hypersensitivity. Serum sickness. A single dose will act as a priming dose as well as shocking dose, type 3. Graves' disease. Previously it was type 5, don't get confused, now it is type 2. You see the previous books, it's type 4. Now they merged with type 2. Autoantibodies against thyroid stimulating hormone, stimulatory antibodies. Leads to hyperthyroidism. PK reaction, Prausnis-Kutz reaction. That means passive transfer of type 1 hypersensitivity. PK, Prausnitz-Kutzner reaction. Lepra 3 reaction. What is Lepra 3 reaction? Lucio phenomenon, or otherwise called erythema necroticans, seen in Caribbean countries. It belongs to type 3 hypersensitivity. Lepra 2 and 3 reactions, type 3. Lepra 1 reaction belongs to type 4. No confusion. Lepra 1 type 4, Lepra 2 and 3 type 3. Okay, good. Next is source and agent, different type of source. I borrowed it from dermatologist, beautifully mentioned, Lepra venata, very good. Seven o'clock onwards, I'm waiting, no? Okay. School sore is nothing but impetigo. Impetigo caused by Streptococcus pyogenes or gas. Oriental sore is otherwise called Delhi boil, Baghdad sore, Leishmania tropica, cutaneous leishmaniasis. Cold sore, it's a blisters from herpes, human herpes virus 1 and 2. They produce blisters, that's called cold sore. Prousnitz, Ayman asked Prousnitz-Kushner reaction. I got a question. Doubt, guys, what is PK? I am also a guy, so I am answering. It is Prousnitz-Kushner reaction, Ariman Suri. Okay, right. It's a passive transfer of type 1 hypersensitivity. I am coming back here. Soft sore or soft chancroid is Haemophilus ducrei, painful. Hot sore or Hunterian hot chancre is Trichoderma pallidum, syphilis. Swimming related, swimming disease and agent. Swimmer's itch, it's otherwise called cercarial dermatitis. Schistosoma. When the cercaria penetrates the skin, it produces itch called swimmer's itch. Swimming pool granuloma. Yes, suddenly you'll go from parasite to bacteria. Zigzag. Mycobacterium marinum. Beautiful. Swimmer's ear. Malignant otitis externa. Please remember, swimming pool granuloma otherwise called fish tank granuloma. Mycobacterium marinum. Swimmer's ear otherwise called malignant otitis externa. Pseudomonas aeruginosa. Malignant otitis externa, Pseudomonas aeruginosa. Swimming pool conjunctivitis. Many people, adenovirus, chlamydia trachomatis, many other people. Adenovirus, chlamydia trachomatis, many people used to cause. Swimming pool meningoencephalitis. The trophozoites penetrate the nasal mucosa, go to the brain, it causes amoebic meningoencephalitis. By Acanthamoeba and Naegleria, free-living amoebas. Acanthamoeba causes granulomatous amoebic meningoencephalitis, GAME. Naegleria causes primary amoebic meningoencephalitis, PAM. Got it? That's all. Meningoencephalitis. Great. Rose is the rose. Huh? Condition. Agent. Rose Gordon's disease. Always, whenever you think of rose, think of first Rose Gordon's disease. Sporothrix. Thorn-prick. So don't think thorn-prick only causes Rose Gordon's disease. Thorn-prick may cause tetanus also. Thorn-prick may also cause Pseudomonas infections also. But common, this one. Rose spot. Yes, every third year student should know this. Typhoid. Rose spot. Rose water test is a little outdated, but sometimes they mention. To diagnose, it's a complement fixation test model. It's for rheumatoid arthritis. Yes, this is another important MCQ, Rose Bengal cod test. To diagnose brucella, suppose milk after pasteurization, we want to know whether brucella is there or not. We are using Rose Bengal cod test for brucellosis. Roseola infantum. It's called sixth disease. Human herpes virus 6 causes. It's called sixth disease. Roseola infantum or Exanthum subitum. Rose fever, little tough. But sometimes if time is not good, the question may be there. Rose fever is nothing but hay fever. Hay fever. So these are all something related to rose. We need to segment and read, enjoy and read. When you travel along with your friend in the bus or wherever it may be, or in tea time, crunch time, just I'll ask related, rose related, like a game. I'll ask swimming related. Like that, you ask, you will not forget. The question may be big history. Only one line will come. He got a thorn prick when picking some roses like that. That's all. And they found some rose color spots. That's clinician. That's all. So please remember, these points are valuable. Even one point, it gives a clue to you. All are informers to you. Secret informers of the answer. You need to identify the informer. Common name and disease. Black disease. Black disease is Kala-Azar. White plague. Common name. It's a very common name. White plague is very common. Everybody knows in India. You must know. Tuberculosis. Black death. Black disease is Kala-Azar. Black death is plague. Pink eye. Adenovirus and chlamydia both will cause pink eye. Blue color pus. Wherever green color and blue color comes, you please remember Pseudomonas. But Pseudomonas also produces a red color and brown color also, yellow color also. Pyocyanin, pyomelanin, pyoverdin, pyorubin, all the pigments. Pyorubin red color, pyoverdin fluorescent yellow color. Pyocyanin blue to green color, pyomelanin black to brown color. So it produces almost all the colors. Red disease. What is called red disease? Sporothrix, rose gardener's disease, otherwise called red disease. Please remember. Red disease. This is something related with colors. Enjoy and read. Most common pigment pyocyanin. Pyocyanin. I got the question. Sandipan Bhattacharya. Pyocyanin. And function of the immunoglobulin. One-liner. The immunoglobulin which involved in opsonization is IgG. Agglutination is IgM. Pentamer. Anaphylaxis. IgE. Mucosal paint. Protect the surface. IgA. And the one and only immunoglobulin which transfers, placental transfer is IgG except IgG2. Except IgG2. Alternate pathway. A for A, IgA and little amount of IgG4. IgG4. Alternate pathway complement. IgA, little bit amount of IgG4. Okay, placental transfer IgG except IgG2. This is all the whole immunoglobulin what you read, this is the juice. You must know this. People who studied immunoglobulin to answer work out the MCQs from DQB, they understand the value of these 6 points for whole immunoglobulin. Smell, fishy smell. They give the clue. The bacteria colony have the fishy smell. Proteus. Sweet fruity smell or grape smell. Yes. Pseudomonas. Sweet fruity or this thing, Pseudomonas. Green apple. Alcaligens fecalis. A rare question, don't worry. Mouse cage. Echinella corrodens. When you talk about HESEC group of organism, culture negative endocarditis, then they give the clue. Mouse cage. Rotten fish. Yes, amine order. You can go for bacterial vaginosis. Amine order. Caramel smelling. Cat scratch disease. Bottonella Hensley. Bottonella Hensley. This regarding smell. You can read with smell. These are all the clues. Again I am telling, these are all the clues. Disease and agent. Which one cause water can perineum? Multiple abscess with discharge in men is a complication of gonococci. Waterhouse friction syndrome, bilateral adrenal hemorrhage, petechial rash, DAC, it's caused by meningococci. Fulminant meningococcemia. Banwarth syndrome, neuroborreliosis. Banwarth syndrome, neuroborreliosis caused by Borrelia burgdorferi. Hemolytic uremic syndrome, obvious, very common, enteric hemorrhagic E. coli, and Shigella dysentery also, but common is E. coli, O157H7. It produces hemolytic uremic syndrome and hemorrhagic colitis. Hepatorenal syndrome, leptospira. It affects the liver and kidney, acute renal failure, hepatitis. Toxic shock syndrome, commonly caused by Staphylococcus aureus. They have a toxin also called toxic shock syndrome toxin. It also caused by Streptococcus, but common Staphylococcus aureus. Common things are common. You must know the common things first. Twin condition, Dine's phenomenon. I always used to tell my class, P for Proteus. Dine's method, M for mycoplasma. M for mycoplasma. Honeymoon cystitis. Usually Staphylococcus saprophyticus and E. coli. Gram positive Staphylococcus saprophyticus, gram negative E. coli. Honeycomb crust, impetigo. Step pyogenes. Cat bite abscess, just now we told. Cat bite abscess is Pasteurella. Cat scratch disease, Bottomella Hensley, just how I told. Cat bite abscess, cat scratch. These are all confusing, little bit, all are looking similar. Like MCQ choices looking similar, they'll confuse you. Next is target rash. The feature of Borrelia burgdorferi, Lyme disease. Target hemolysis produced by Clostridium perfringens. Beta hemolysis followed by alpha hemolysis. Beta, outer is alpha. Erythema arthriticum, joint pain, is a feature of Haverhill fever caused by Streptobacillus moniliformis. Erythema multiforme produced by herpes and mycoplasma. North American blastomycosis. Blastomyces dermatitis. South American blastomycosis, paracoccidioides. And European blastomycosis by Cryptococcus. Good. Twin conditions, nurse cell. You can see the nurse cell, the calcified Technala spiralis, nurse cell. Flame cell, you can see in the structure of schistosoma. You can get the flame cell near the ovary. Dust cell is nothing but macrophage in the lungs, alveolar macrophage. Cooper cell in the liver, like that. Foamy cell, the macrophage filled with Mycobacterium leprae. That's called foamy cell or lepra cell or virchow cell. At Medusa colony, yes, famous bioterrorism agent Bacillus anthracis. Daisy head colony, yeah, that's confusing, tongue twisting. Okay, it's Corynebacterium diphtheria gravis. Next is cold abscess, where you can get Mycobacterium tuberculosis in the spinal cord. Cold abscess, usually Mycobacterium tuberculosis, vertebral osteomyelitis, cold abscess, pot spine. These are all the features of Mycobacterium tuberculosis. Cold enrichment, which grows in cold temperature. Listeria. Which is called cold antibody? Basic. IgM. Cold sterilization. The method is called gamma radiation. For plastic syringes, catheters, all plastic items, catgut, we do with gamma radiation. Cold agglutination test. We are using to diagnose cold agglutinin. Many conditions, commonly mycoplasma. Cold sore, already told. Because of importance, I am repeating this. Cold sore is nothing but herpes. Okay. Next is, yes, find the diagnosis. Feeling hungry? Me too. My food is waiting, but late actually. I need to reheat and eat. But reheating is the trouble. Reheated fried rice. I'm also having fried rice outside. It's my room waiting. Bacillus cereus. It produces emetic and diarrheal type. Fried rice, Chinese fried rice. Bacillus cereus. Hamburger. It leads to hemolytic uremic syndrome and hemorrhagic colitis. Canned food, where the history comes canned food. You think of Clostridium botulinum. It produces many things: wound botulism, gastrointestinal, infant usually honey, wound from environment. So gastrointestinal botulism with canned food. So this every word is important. After consumption of fried rice, think of serious. Hamburger, think of enterohemorrhagic E. coli, like that. Anyway, 12 o'clock, it's over, no problem. We are crossing one day. We are batting on day 2. I am the night watchman. See here, seafoods, Vibrio and Astrovirus. When consumption of salads, think of Staphylococcus aureus and Clostridium perfringens. Oysters, Vibrio. So seafood, oyster, remember Vibrio. And salads, usually Staphylococcus aureus and Clostridium perfringens. Every food item will relax. Cheese. Yes, cold enrichment, Listeria. Consumption of cheese may lead to many other things. Brussels also cheese, any dairy products, but commonly associated with Listeria. Cheese. Brussels means any dairy product, meat, milk, many things. Egg means salmonella. So make the food items and the corresponding ice cream salmonella. So make the food items and the corresponding pathogens. Strawberry tongue, gas, group A beta hemolytic streptococcus. Strawberry cervix, Trichomonas vaginalis. Coated tongue, rose spots, relative bradycardia, all come like this. Muttering, delirium, coma, vigil, all features of typhoid fever. What is the line called? Pasture line. This also group A beta streptococcus. Scarlet fever, pasture lines, strawberry tongue, sandpaper rash, these are the features. In the case scenario, key points are diagnosed. If the person used vaginal tampon at the time of menstruation, toxic shock syndrome, Staphylococcus aureus. The person using antibiotic then develop the diarrhea, especially clindamycin or cephalosporins, pseudomembranous enterocolitis, Clostridium difficile. Person using prosthetic valve, they develop infective endocarditis, Early stage, epidermidis. Late, more than 1 year, is bredens. Early, less than 1 year, epidermidis, staph. Kawasaki also, you can get a Esanisha. Kawasaki also, strawberry tongue is there. Yes, what appearance? Mickey Mouse appearance. It's a diagnostic feature of Paracoccidioides brasilensis. Mickey Mouse or pilot wheel appearance. Owl eye appearance. Sorry, wrong mistake. Owl eye appearance, cytomegalovirus. Owl eye appearance, cytomegalovirus. Next is, it's called figure of 8, BBB. What is BBB? Broad-based bud. Figure of 8 is diagnostic of blastomyces. And this is India ink, budding yeast cells with halo capsule is Cryptococcus neoformans. Cryptococcus neoformans. Spaghetti meatball appearance or banana grapes appearance. Yes, come on, shoot, spotter. It is Malassezia furfur. Chains of orthoconidia. Orthoconidia. You can see in many fungus, commonly Coccidatis immitis. Coccidatis immitis. See here. Spindle shaped macroconidia. Diagnostic of microsporum. Then you should think how the epidermophyton, club shape. How the trichosporum, trichophyton, pencil shape. So you should know others also. See, there is a root-like structure, rhizoid. That also just beneath the stump, sporangiophore, nodal rhizoid, seen in Rhizopus. No rhizoid seen in Mucor. Internodal rhizoids seen in Absidia. Absidia. Yes, very famous picture. Broken pink ball appearance. Commonly seen in Pneumocystis. Most common cause of fungal pneumonia in HIV positives. Non-cultivable fungi. Treatment, sulfur drugs. Yes, this is called asteroid body. Sporothrix. Asteroid body, sporothrix. Where Medler's body, copper penny bodies, chromoblastomycosis. Yeah. Trophozoite with cilia. See, a trophozoite with cilia. Largest. And horseshoe shape. See here. Horseshoe shaped nucleus. Very important. Horseshoe shaped nucleus. Feature of Balantidium coli. Trophozoite. Yes. Acid fast oocyst. Very small. 4 to 6 cryptosporidium. 8 to 10 cyclospora. And oval shaped cystisospora. Oval shaped cystisospora. Okay. Sir, get a very good message. Sumit sir, it's a timely needed message. See, pear shape, falling leaf motility. Who is this? Giardia lamblia. It produces steatoria. Immediately, Giardia lamblia should think of steatoria, vitamin B12 deficiency, string test, 5 to 6 points, that's all. This is motile from vaginal discharge. Trichomonas vaginalis, only trophocyte stage, and it produces strawberry cervix. These are the features. Jerky motility, few points. Ring shape in the RBC is plasmodium. Multiple rings, acole formation is Plasmodium falciparum. See here, cross inside the RBC, Maltese cross. This is called Maltese cross for Babesia. Babesia Maltese cross. Yes, inside the, see the RBC, if you see the RBC, you can get a flagellate structure. This is nothing but trypanosoma, a trypomastigote of Trypanosoma cruzi. Trypomastigote of Trypanosoma cruzi. See here, one cyst has 4 nuclei. Quadrinucleate cyst is the diagnostic of quadrinucleate cyst is Entamoeba histolytica cyst. Giardia also quadrinucleate, but they have an axostyle. One small line will be there. Yes, egg with lateral spine, Schistosoma manzoni. Egg with terminal spine, Hematobium. Knob-like egg is Japonicum. So it's very important. You will find it schistosoma, but terminal hematuria, tearing, manzoni lateral, and Japonicum like knob-like nose. Japonicum has a knob. Egg with two mucus plugs, barrel shape with two mucus plugs. That's all. Treacheries. If you already studied, next minute it will come. Treacheries. Egg with opening. Operculum. Egg for a place for opening. That's called operculated egg. All the trematodes almost, except schistosoma, operculated egg. Egg with 6 hook-like structure. Hexacanth egg. Cystodes. All the cystodes, hexacanth egg, except Diphyllobothrium latum. Diphyllobothrium latum. 3 more slides. Plano-convex, entropious. One description, plano-convex, is the description of seeing the picture. Parasitology, mycology, 100% you need to shoot. No compromise. And 4 to 8 blastosmeas. Egg is having 4 to 8 blastosmeas. Hookworm, Ancylostoma duodenale or Necator americanus. Yeah, egg with mammillated edges with shrunken larva. You can see the crescentic space. You can see a crescentic space here and here a crescentic space is there. This is fertilized egg of Ascaris. Fertilized egg of Ascaris. Unfertilized means full of larva. Full of larva. There is no crescentic space. Next is, yeah. What is the color? Look like it is typical feature of blueberry muffin rash. Blueberry muffin rash seen in cytomegalovirus, parvovirus, and very notorious in rubella. Very notorious in rubella. Next is what is called unilateral periorbital edema with ptosis. It's a classical feature, Romanov's sign, seen in Chagas disease. Trypanosoma cruzi. When take the stool of the assassin bug, which containing the metacyte trypanomastoid, they inoculate like this. So conjunctiva is the ideal portal of entry. It produces Romanov's sign. Romanov's sign. I think Romanov's sign. It's a final one. What is it? This is called Cercariae. Cercariae. It's an infected stage of schistosoma. It only penetrates the skin and produces cercarial dermatitis or swimmer's itch. Hookworm produces ground itch. Okay? Yes. This is called copper penny bodies or medullary bodies or sclerotic bodies or muriform bodies. That is the feature of diagnostic pathognomic feature of chromoblastomycosis. Chromoblastomycosis. Okay? Yes. So, thank you very much. I took some extra time, 10 minutes extra. I'm strongly apologizing for that. But it's not over. The game starts now. Lot of things are there, but you have the idea how to approach microbiology. Okay? So, microbiology integrated with all the subject. So, whenever you read, the one or two, the clinching point for microbiology help you to catch the organism or help you to catch the mechanism of the toxin or the drug of choice or how to arrive the diagnosis or come at least some differential diagnosis. By clinically find 3 to 4 differential diagnosis, microbiology help you to make a full stop for the diagnosis for many times. Okay? So, thank you very much and God bless you. All the best, and still I say it's a good night, even though it's after crossing 12 o'clock. Good night, and thanks for patience. Thanks for patience. Great. I'm waiting. Questions you can put. I'm ready to answer some questions. Yes, I got a question, sir. Immunology, what to do? Don't worry. Immunology, read clinical immunology, hypersensitivity, reactions, complement deficiency, phagocyte deficiency, autoimmune disorders like that. But understanding those things, you need to know the basic immunology. And they will ask applied immunology, what is ELISA test, what is precipitation test, agglutination test, they will ask. And sometimes they'll ask about the CD markers and how to identify the particular cell, T cell defect, B cell defect, like that. So all are integrated. Better you go for clinical immunology and applied immunology with the help of the foundation of basic immunology. Without knowing the basic immunology, you cannot go for cell-mediated immune response or like that. You cannot do that. Yeah, I will go and have my food. Thank you. I'm signing off.